Here we are today at the 3D Dentist Center with Dr. Taylor Agarwal in Raleigh, North Carolina. And I'm teaching an anterior CEREC course. It's a 2-day hands-on course. We go all over the different techniques of designing anteriors like the biocopy, the bioreference, the bio-individual, the combination technique, how to design a pair of centrals with keeping the midline straight. We also go in a lot of hands-on about how to post-mill, how to do a lot of contouring post-milling, how to go in and get your line angles right, how to get a lot of anatomy on your restorations. I teach 4 different techniques of staining and glazing, and depending on the case, depending on the time you have, you can pick and choose and mix and match these techniques to get the best result possible for your patient.
Probably the biggest highlight for me was learning some tools on the software that I'd never seen before. It truly opened my eyes on what I can do with anterior CEREC restoration.
Without a course like this, the CEREC Anterior course, I just didn't have the confidence and the ability to want to even attempt that.
I came to the CEREC Anterior course with the expectations of learning a lot more with using CEREC and incorporating it into the anterior portion of the mouth, but I got a whole lot more out of it.
We have a very cool live session where what we do is before the class starts, we have a patient where we prep some teeth. We give you the RSD file, we give you a model to work on. You go ahead and design your own restorations. Using the model, you mill out your restorations. You do your post-mill contouring based on all the learnings that you do on the first day and a half of the course. And then you apply all those learnings on the post-mill contouring, and you go ahead and get your case ready, and you pick from the 4 staining and glazing techniques that you learn, and you apply it on your live patient case. We bring the patient back and we try each one of their restorations on the patient, and we mutually decide which one is the best one.
And being so hands-on as an assistant in our office, it was really important for me to really grasp the concept of being able to better our crown qualities to deliver to patients. And I learned a lot of new tricks and trades and tips as far as how to make the aesthetics a better quality to deliver to the patients. And also as far as the CEREC machine itself, tools that were very helpful in designing the final product.
It was great to have as much one-on-one that we did have in this course. So I would recommend it for anyone who is either new to CEREC or new to anterior CEREC or wants a tune-up for any kind of anterior CEREC work.
If you're looking into a good anterior course, come join us at the 3D Dentist Group, and you will have a great, fun, intimate experience here, and it will take your anterior game to a whole new level.